The ratio of growing follicles to resting follicles is the key to the amount of hair that you shed every day.
Right.
So hair in the growing phase is never shed. Stress of any kind to the hair follicle that can come in forms of a physical stress, which might be you're ill, you're having fever for some time, you're undergoing some major surgery, you're psychologically or emotionally stressed significantly, you have iron deficiency, then the number of resting follicles increases, and this shedding continues till the stressor, whatever it is taken out. The hairline and the hair tend to frame our face. When that frame goes missing, the face tends to lose character. Many times patients, because of their information they glean from the social media and the internet, they come with unrealistic expectations which cannot be fulfilled in every patient.
Hello everyone, welcome to this episode of the Health Talk with Dr. Sagorika Mullick. Imagine standing in front of a mirror and watching strands of hair gradually collect on the floor. Each fallen strand carries with it not just protein and keratin, but a part of our identity. Hair is far more than just hair. It's a silent storyteller of our genetics, our overall health, and even our cultural narratives. Hair loss touches millions worldwide, yet it remains deeply personal and often misunderstood. I'm lucky to have my friend Dr. Sandeep Sattur, an expert in hair health, as my guest today. Dr. Sandeep Sattur is the founder and lead hair transplant surgeon at Hair Revive, a center for hair restoration and skin rejuvenation in Mumbai. For the past 20 plus years, his practice is exclusively limited to hair restoration. He has been involved in follicular unit micrografting since its introduction in India and also addresses hair loss due to burns and trauma. He prioritizes patient education, is conservative in his surgical approach, and always tries to promise less and deliver more. He is an alumnus of the Grant Medical College, Mumbai, India, and has completed his MBBS, MS General Surgery, and MCH Plastic Surgery from this institute. He is an active member of the Hair Restoration Surgeons Association, both nationally and internationally. Welcome, Sandeep, to the Health Talk.
Thank you.
Okay. So, Sandeep, you are specialized in plastic and cosmetic surgery, right? So, what made you decide to focus only on hair restoration?
Actually, in the first part of my career, I was doing reconstructive and cosmetic work.
Okay.
And hair transplant was a part of my practice.
Right.
But over a period of time, the interest in the hair follicle as a miniature organ took over.
Hair follicle is an organ?
Yes, it's a miniature organ. It's like a microcosm of our entire body. You have a lot of information coming from the follicle. And that just got me interested and why we lose hair and what can be done about it. And once you go deeper into something, then you prefer to stick to that as your basic practice. And that's how I landed up doing only hair restoration.
So how many years have you been doing only hair restoration?
I did my first hair transplant in 98. But dedicated hair practice was probably from 2004-05.
So, whenever I talk to you, you always say that, no, Sago, it's okay. Hair loss is normal. Hair loss is normal. But, how does a person understand what is a normal hair shedding and what is actual hair loss?
The thing about hair is that we are blessed with about 50 lakh follicles on our body. Each of these follicles manufacture different types of hair under different circumstances. When you are born, you have terminal hair, which is the thicker hair that you have on the scalp, eyebrows and eyelashes. As you grow, hormonal influences will decide. If you are a male, you will start having facial hair. At puberty, you will have pubic hair, axillary hair. So, these follicles will continue to change as per the situation. Baldness is also a part of that. But if you look at our follicle, it is not that it will keep growing the hair all the time. So each of the regional hair, like the scalp hair differs from your eyebrow hair, differs from the torso hair, differs from the beard hair. So everything is different. And if you look at the scalp hair, let's stick to the scalp hair. So you have a phase of growth.
Right.
So the follicle produces a filament of hair, which will continue to grow for about 2 to 8 years in an average person. After that, there is a phase of involution. And that involution, the manufacturing capability of the follicle stops completely.
Okay.
And it goes into the rest phase, which will be there for another couple of months.
So it's tired of growing
months.
hair again and again.
Yes.
So it just wants to take some rest. Okay.
Yes. So
fine.
the resting follicle remains in that phase for about 2 to 4 months. And around the end of this phase, it will shed the existing hair. And after a small latent period, it will come back into the growth phase. Each follicle goes through this cycle umpteen number of times in your entire lifespan.
Okay.
So the ratio of growing follicles to resting follicles is the key to the amount of hair that you shed every day.
Right.
So like I said, we are having 50 lakh hairs. Only 100,000 is on our scalp.
Okay.
So 100,000 approximately on the scalp. 90% of this is in the growing phase. So hair in the growing phase is never shed unless there is a pathology or some other altered situation, but not routinely.
Not routine. Okay.
And out of the 10% in the resting phase, some hair might be shed on a daily basis. So if you equate that amount, so about 10,000 hair in resting phase, shedding of 30-50 hair on a daily basis is quite routine. This is a very arbitrary and anecdotal figure. There is no documentation of what is normal. So what is normal for you will be different for what is normal for me or somebody else.
Right.
So it is not a fixed number, but approximately what a person sheds on a daily basis, that person knows when that quantity exceeds. You come to know that you are seeing more hair around you than what you normally see. That becomes pathological.
So, can you just explain to us what is the science behind that, hair growth or hair fall?
See, basically, like I said, if you look at the ratio of growing hair to resting hair, we need to identify the problem that a person is having, whether it is that person is shedding excessively, or that person is having a visible scalp due to reduction in the caliber of the hair. These are two different things. When a person has a normal growing hair to resting hair ratio, it is typically called as anagen-telogen ratio.
Okay. So anagen is growing and telogen is resting.
So if you have this ratio of 9:1, that is when everything is hunky-dory.
Oh, great.
When there is a problem. Now, when can there be a problem? Stress of any kind to the hair follicle. That can come in forms of a physical stress, which might be you're ill, you're having fever for some time, you're undergoing some major surgery, you're psychologically or emotionally stressed significantly, you have iron deficiency, then the number of resting follicles increases. And this change in the growing hair, resting hair ratio decides. Like I said, if it is 9:1, shedding 30-50 or 100 hair is okay.
Right.
But imagine if this ratio goes 7:3, then it is 3 times that amount that you will shed on a daily basis. It becomes visible.
Obviously.
And this shedding continues till the stressor, whatever it is taken out. So what is commonly seen, let's say postpartum or post-delivery. A lot of women experience hair fall.
True.
During pregnancy, the hormonal environment is such that is very favorable for the follicular growth. So more follicles are in the growth phase.
So that means you're saying that during pregnancy, women can grow hair?
They are having the best hair of their time, of their life.
Okay.
At least in those women who do not have any other nutritional or any other medical compromise. They will have very good hair.
Right, Sandeep. So you were talking about this hair fall and hair loss. So what is the science behind actual hair loss? Like, why would somebody lose hair?
As an organ, the formation of the hair follicle starts around in the 9th week of the intrauterine life.
That early?
Yes. And by 22nd week, all the follicles are complete. After birth, not a single follicle can be added. In the sense, on its own.
Okay.
When you look
at... So we are born with all the
follicles in place. It is just that for a person to start sprouting facial hair, it comes because of the change in the hormonal environment. That the follicle will change the type of hair it is producing.
Right.
So the follicle goes through different phases, like I mentioned.
Right.
But the issue about what we see, like commonly what we say is the common baldness.
Yes.
It is not that the follicles have disappeared. It is
Okay.
just that they were producing a hair that was 90 to 110 microns in diameter. Now it's producing hair in 5 or 10 or 15 microns in diameter, which the naked eye will not pick up.
Okay.
The hair follicles are still there. They
Acha.
are functional. So it is this gradual reduction in the caliber which happens,
Okay.
which is responsible for the baldness. So that I always tell patients that you need to understand that you cannot say it is hair fall. Hair fall means that you are shedding the hair shaft.
Right.
Or hair loss, which means they produce hair that is thinner. Now, if you imagine a piece of paper, like an A4 size paper, and you keep 20 tennis balls on that.
Right.
The paper is completely covered.
Yes.
That is a situation when everything is hunky-dory, there is no problem.
Right.
Come the onset of hair loss or male pattern or female pattern baldness, and you see that out of the 20 balls, 10 balls have become table tennis balls.
Okay.
So the paper is becoming
visible. Yeah, right.
It is not that the balls have disappeared,
Right.
it's just that they have become...
Size has reduced.
And as it gets advanced further, the table tennis balls will become a marble. I'm giving you an analogy where you understand the sizes.
Right.
So this is how the visible aspects of the hair loss come about.
Okay, so they may just keep becoming thinner and thinner. Okay. Now, Sandeep, hair is a very important part of our personality, right? You know, we are very conscious about our hair, whether we have it, we don't have it. So how does it affect, like, you know, our body image emotionally, psychologically? I'm sure your patients must be coming and asking you a lot of questions or explaining their situations. Please tell me your perspective on that.
The primary role of hair as basically protective in nature.
Yes, but I think it is more visual in nature.
Today, psychosexual communication is based on your hair. Extent of hair you have, the way you style it, the way you color it.
Right.
It is a statement about your attitude.
Yes.
About your beliefs.
Yes.
You know, various cultural changes that come. So it is important in that aspect.
Yes.
More importantly, for people, the hairline and the hair tend to frame our face. When that frame goes missing, the face tends to lose character. Your facial identity is determined to a large extent by the hairline, which is of course because of the hair that you have.
True.
And once the hairline is knocked off, the part of the frame goes missing.
Right.
And that is where the problem starts. So when I have patients who are having issues with their hair, patients come to me because all of us in our mind have a body image which we have, the way we have visualized ourselves.
Absolutely.
Then when we see the mirror, what we see in the mirror does not match what we have in our mind.
Yeah, right.
And that is the problem that people face when they come to consult for hair.
Right. So what kind of hair loss, what are the different types of hair loss which you see in your practice?
See, for a lay person, it is important to know that hair loss can be classified in many ways.
Okay.
We are not talking about hair fall situation, but more of an hair loss.
Right.
So, hair loss can be looked at as which occurs in a pattern.
Okay.
So, when I say pattern, it is a pattern that is very unique. So, the front, the middle and the top of your head generally have follicles which are not as long living. And the follicles on the sides and the back, like that horseshoe shaped area, are relatively more long living. So when you have hair loss that preserves this part and you lose this part, it is known as patterned hair loss.
Okay.
So you can have patterned hair loss or unpatterned, where it can be anything.
Anywhere.
So patterned hair loss is genetically, hormonally determined. Unpatterned hair loss is usually pathological. It is due to a skin condition or an autoimmune condition which is causing this random hair loss issues.
Right.
It can also be classified depending upon the pathology, where does it involve a level of scarring of the skin or not scarring. So sometimes inflammation in the skin of the scalp, can damage the follicles permanently. That is known as scarring hair loss.
Okay.
And in some cases, without any damage to the skin, the follicle still may not function properly. That is non-scarring hair loss. So the basic differentiation is in that way.
Right.
Then you can classify hair loss between genders.
Okay.
Male pattern hair loss, female. Now the distinction between male and female is very typical. In men, usually the hairline is affected and they start receding backwards.
Right.
Or they may have an isolated crown baldness.
Crown baldness, right.
In women, their hairline is usually intact.
Okay.
The thinning is behind the hairline. So you have thinning in the frontal and the mid scalp areas. For women, they end up concealing it by changing their hairstyle.
Right.
They have comb over options which they can comb their hair from one to the other side, thereby concealing the length of their hair,
right.
which is not possible in all men. The lack of hairline shows, and hair loss in women is more diffuse in nature as compared to men. And generally in women, we don't see frank baldness, which we see in men.
Right.
So these are critically differences if you look at classifying hair loss.
What about children? Can they also have hair loss?
Children can have genetically determined hair loss where there is a basic defect in the follicle.
So you have seen children also with hair loss?
They are there, and they are always accompanied by other congenital anomalies which go with these kind of hair losses. Sometimes they have conditions which are autoimmune in nature. These are commonly alopecia areata, where the body attacks its own follicles, and they have patches of hair loss which may involve not only the scalp but the eyebrow, eyelash.
So it's again an autoimmune
problem. Or you can have what is known as nutritional hair loss in children because they may have significant protein energy malnutrition or iron deficiency. These are known to cause hair fall, which gives them a very thin, dull, light-haired look.
But that is only in extreme conditions,
yes,
right?
Not in a routine thing. But other than the congenital conditions, alopecia areata is they can't have male pattern or female pattern because these are driven, especially male pattern, are driven by hormones.
Right.
So in children, hormonal excesses don't occur till they reach puberty age.
Right.
So that is the basic difference.
Okay. So generally, see, for all possible problems nowadays, we talk about, lifestyle factors or other factors, which can influence a particular disease. I mean, does hair fall also have different factors which you can influence? I mean, what are the factors which normally influence hair fall or any hair pathology?
See, the hair follicle per se has one of the most, it's highly metabolic in nature.
Okay.
And it is of that caliber that it can match the bone marrow in terms of the metabolic activity that it has. So it is that high in terms of requiring energy, nutrients, everything. But because from an evolutionary perspective, our bodies are designed to protect the more vital organs over something that nature will consider vestigial today.
Right.
There is a mismatch. Even if there is a nominal drop in the nutritional supplements, there can be. But this kind of hair loss is not patterned hair loss. It is globally affecting the hair.
Right.
Now, lifestyle per se, when you talk about metabolic syndrome, which is seen in a lot of young individuals today, that can have a negative impact. We have seen a lot of common features between people having metabolic syndrome and a rapid progression of the patterned hair loss.
Right.
It is, smoking. There are enough number of publications which have proved that smoking is detrimental to your hair.
Okay.
I tell this to all my patients that whatever you do, smoking is going to really take a toll. Now, they will say XYZ smokes, is a chain smoker, but his hair is good. Genes will work. So these lifestyle factors, so they may modify the way your genes will express. And that is why lifestyle is an important factor. And a good lifestyle may not be able to negate everything your genes have programmed, but at least it will stabilize whatever your follicle can do in the existing genetic environment.
So you mean to say the genetic factors are more important?
They override everything.
Okay.
But epigenetic influence can influence the final expression of the genes.
Right.
So that is what is critical when it comes to lifestyle.
Right. So as I was telling that, when we are talking about factors, a lot of people are already in other medical problems and they have a lot of other medications they are taking. Does medication also affect hair fall or any hair problem?
Commonly what have been noted are the tricyclic antidepressants, some beta blockers, retinoids which are used for acne. These are all known to have a detrimental effect on hair. there are some medications which are used to treat malignancies.
Right.
They are directly harmful to the hair. Again, why this is important? Because the malignant cells, the bone marrow, the hair follicle, they all have the same type of metabolism, which is very different from other cells of the body. So when drugs which are meant to hit the cancerous cells, they will hit all the cells in the body which have the same metabolic
The
type.
fast growing cells you are trying to say.
Yes, the bone marrow, cancer cells, hair follicles.
So they are the fastest growing cells in our body,
Yes.
normally.
Yes. So these cells, when they are hit by the cancer medication, they will hit the cancer medication, but they will also hit the bone marrow. So you will see patients having a drop in their counts and everything.
Yes.
But they will also have hair fall.
But then that hair fall can be reversed.
Is usually reversible.
That's a good thing.
And so this is a direct hit. So this is the only time that a growing follicle can actually shed its hair. That is the only time you have hair fall in a growing follicle. That and alopecia areata is the only two times when you see the hair fall occurring in a growing follicle.
Okay, so that is the reason people going through chemotherapy lose a lot of hair.
Yes.
Okay, fine. So, can hair tell us that is there any underlying other health conditions? Like, can it tell a story about our health?
Two things that come to my mind, which I see in my practice, is iron deficiency anemia and hypothyroidism. They may present only with some signs in the hair, the scalp hair, but no other symptoms otherwise.
Right. So anybody having a hair loss should check their hemoglobin and their thyroid status.
It's not important to check only the hemoglobin. So this is the catch here.
Right.
What they have usually is known as non-anemic iron deficiency.
Okay.
So you may have a hemoglobin that is 12.5, 13, but the iron stores will be suboptimal. When I say suboptimal, they are not frankly low. If it's frankly low, the hair will tell its own story.
Right.
You will see the hair being lighter in color, dull to look at. The moment you supplement iron or correct the iron deficiency, the hair will get a vitality of its own.
So how do you check that suboptimal?
So when you check complete blood count, you look at the C-reactive protein, you look at serum ferritin, the detailed iron study which will have the serum iron, the TIBC, the transferrin saturation. So it gives you an overall picture as to where the iron status is. Based on that, you can correct. And once you correct, it will work very well.
So the hair fall will come down.
Hair fall will come, the hair caliber, hair color, everything will improve.
And what about hypothyroidism?
This is my personal opinion. In my practice, at least 30% of the patients we investigate who are not known hypothyroids have been found to have raised levels of thyroid stimulating hormone. Now, what happens is, if it's a borderline case, most of the endocrinologists don't feel the need to supplement the thyroid
very
hormone.
True.
Because they feel it's not clinically relevant.
Right.
But as a person treating hair loss, I feel it is very relevant that the earlier you correct it, the better effect the other medications that we use to treat the hair loss will work.
So if somebody who's coming as a hypothyroid, borderline subclinical hypothyroid, and if the person is complaining about hair fall, or we should at least ask about hair fall.
Apart from the hair fall, the thing is that they'll have thinning. Because you see, the hair follicle has got thyroid hormone receptors.
Oh, okay.
So one thing is for sure that a low functioning thyroid will impact the hair. Optimizing the function of thyroid in terms of supplementing the thyroid hormone is a good starting point to manage the hair loss also.
Right. So important from our perspective also as clinicians, we need to keep that in mind. What is the role of nutrition? I'll take some B12 vitamins, I take some vitamin D. I mean, supplementation. What is the role of that in hair management or hair health?
Like I said, being metabolically very active, the hair follicle needs a good supply of calories, micronutrients, and nutrients. Everything is required in a steady supply. Now, one should not confuse this with patterned hair loss. It's the common baldness. People think that they are having common baldness because they are not having an adequate status of vitamins in their body. So they keep taking. The biggest scam I feel is this biotin things. Biotin supplementation, people are randomly taking biotin, which I don't really see it helping. In a person who has normal levels of nutrients, adding supplements has never changed the hair quality.
Okay.
A simple analogy that I tell a patient who has come to me, a male patient, He's having frank baldness and lost his hairline, but has a very robust mustache and a beard.
Right.
So, how can the same face have vitamin deficiency on the scalp and not have it on the beard?
Absolutely.
So, I always tell patients that if you can document the vitamin deficiency, then correct.
Right.
Randomly supplementing it, I don't think is the answer for this. It's a huge placebo effect.
Play on the emotions,
Yes.
because hair is very important
And it is-
emotionally.
It is generally perceived as harmless. What will happen if you take more of vitamins?
Oh,
No, certain vitamins, especially vitamin A, if you exceed a dose, it's a fat soluble vitamin, so it will
Absolutely.
accumulate.
Yes.
If you take beyond a certain point and you have excess, that itself will cause hair loss. Selenium, too much of it can cause hair loss. So these things have to be known.
So don't self-medicate even on
Yes.
vitamins part. Now we are going to come to a little bit of a controversial topic, okay? See, I had a lot of hair frizziness, so I did. Parlor said it's a Botox treatment, and straightening it definitely. What I'm trying to say is it helped me my hair's frizziness to come down. So as a hair expert, what is your opinion? Do they help? Do they damage the hair? Should we do it? Shouldn't we do it?
See, you have to understand this. The reason you see frizz, now let's understand what is frizz.
Right.
There is a charge between two hair which makes them stay apart. That is flyaway hair. The cuticle scales that are the outermost covering of your hair shaft are normally lying flat.
Okay.
For some reason, either due to weathering effects, grooming procedures, use of poor quality hair care products, or procedures like coloring your hair, these scales rise up. So when they rise up, they are creating a visual image that the hair is not aligned to each other. So the cuticles which are flat will reflect light uniformly. When they are raised, the light is scattered. So there's a dull look that comes. And frizz comes because there's a repelling action of these hair against each other. So what most procedures do is they flatten these.
They just align that in the same line.
See, you are not born with poker straight hair.
No.
There were natural curls and waves, whatever is there.
Right.
When you change the morphology of hair, either by virtue of curling it if it is straight, or straightening it if it is curled or wavy or frizzy, coloring it if it is gone grey, or streaking it if you want some additional
colors in the
hair. All these which change the morphology of the hair are technically damaging to the hair shaft. They don't hit the follicle, but the shaft is damaged. Now, the difference between the hair shaft and let's say our skin, if I were to create a scratch here, this scratch will heal on its own.
Right.
Because this is a living tissue. Like skin.
Right.
Hair is dead protein. I create anything to it, I make any changes to it, it will remain like that till the hair completely grows out and sheds. So when you did Botox, it straightened the hair from the root till the tip. The moment your hair starts to grow, proximal to 3 centimeter will have the same waviness.
Yes.
The distal ends will remain the same. There are different types of bonds in the hair shaft. The idea is that you break these bonds. Bonds can be broken by heat and by chemicals.
Right.
Now, for these chemicals to enter the cortex, break the bonds, you need to use certain substances to take away a protective film. The F layer, which is the protective layer, is taken off. Then only these chemicals enter. So once you break the bonds, you realign them in the way you want it, whether you want to straighten them or whatever.
Right.
So the potency of these chemicals will grade them. Even hair color for that, permanent hair color, you have to enter the cortex, only then will it be permanent. If the color stays in the cuticle, it is going to bleed off as you washed your hair.
Right.
So any of these will break the F layer. And the F layer is the conditioning layer which is responsible to give your hair that shine and the orientation. That once that layer is gone, there is frizz.
So basically, when I'm doing these kind of products,
if you keep repeating,
I'm damaging my hair for the looks.
Yes, it is. See, there is going to be some collateral damage. You are getting an appearance that you want. But if you repeat this over and over again, that hair shaft which is already been treated multiple times becomes porous. It will absorb moisture. It will swell up. It will dry. It is prone to breakage. So that is the downside of any of these treatments. So each one of us has a different type of hair. You may do very well with these treatments.
Right.
Somebody else will not do well at all.
Right.
They will have a catastrophe because of breakage and everything. So we need to see the type of hair. Attempting these treatments should be tempered with what kind of hair you have got.
Right. One more thing, like, we have got n number of gels, shampoos, conditioners, all claiming that, it is going to arrest hair fall, it is going to improve hair growth and all. What is your opinion on that?
Any shampoo, gel, or anything that is applied to the hair shaft which cannot be absorbed into the scalp will have no role to play.
Shampoo does touch our scalp, doesn't it?
Yeah, but it doesn't penetrate inside to reach the follicle. The follicle is below the scalp. Whether it is hair oil or gel, they are basically styling products. They are not meant to grow. So if you are looking at all these products, they are going to work on the shaft, which is going to be in contact for maybe 2 minutes or 5 minutes. How can they have an improvement? Because they cannot penetrate the shaft also to go and give that tensile strength to this.
But you're, actually breaking the hopes of a lot of people. We always hope that, I'm going to use this oil and my hair will grow.
No, the concept about hair oil is only unique to our subcontinent. It is not very popular outside our subcontinent.
The natural remedies which our grandmothers, you go, they swear on coconut oil.
I know. Coconut oil, by virtue of its molecular size, is one of the few oils that can penetrate the hair shaft. But they cannot reach the follicle. See, the follicle is the business end of your hair.
Right.
It is the one that is a living organ.
Okay.
So to be able to reach there, only those products will work on your growth.
Right.
What is working on the shaft is not going to impact the growth. So hair oil, simply put, will only work as a pre-wash conditioner. Nothing more than that.
Fine. What about this over-the-counter products like minoxidil? Biotin, you already said it doesn't work so much, but what about minoxidil?
Minoxidil probably is the only molecule.
A lot of pharmacies,
which has
they promote it.
A significant level of evidence to support its benefit on hair.
Okay.
Now, the unique thing about minoxidil is that it was originally a drug used to treat refractory hypertension.
Right.
And they found that people who are on this product were growing hair everywhere. They formulated it to be used topically. Now, the thing is that minoxidil as a drug, it's a pro-drug.
Right.
So it needs to be converted to the active drug and then it will work. So when you apply minoxidil on the scalp, it reaches the follicle and in the follicle there is an enzyme which converts minoxidil to minoxidil sulfate.
Okay.
And then it will work on the follicles. Basically, it will work on the growth phase.
Right.
So the growth phase will increase. Now, what happens is every person who has hair loss, the causes are very different.
Right.
And I personally believe that though it is an over-the-counter product, it is over-the-counter because of its safety. Indications have to be chosen at least by a qualified person to see if it will help a particular person. There is also a thing that it is generally approved even as a over-the-counter thing. It has to be used by a person who is 18 and above. It is not that it will have a drastic effect, but it is not something that I would recommend.
Right.
So, if you want to start these treatments, it is better to do it under some supervision.
Right.
And the second thing is that we don't have data on any of these products for long term because hair loss is not a temporary problem. Patterned hair loss is something that is long term and it is going to progress with age. So your treatment also is going to be long term.
Right, of course. All right. So now let's come to the job which you do or the work which you do every day. That is hair transplant. Okay. So, how does hair transplant help? Is it a permanent procedure? Or today if I say that, okay, I've got a loss and I've done all my life that will be taking care of my hair?
No, that is the biggest fallacy about what people believe. See, when you're managing hair loss as a hair transplant surgeon,
right.
Hair transplant is part of the solution. It is not the whole solution.
Okay.
So you must understand that when we label somebody as having male pattern hair loss or female pattern hair loss, the first point that I tell the patient is that this is a condition that is going to get worse with age. So it is something that is progressive. So intervening at one point in your lifetime is not going to solve the problem for the lifetime. Second thing is that the quantum of hair loss varies from person to person. So technically, if we look at a person from the age of 60 to 80. Studies have shown that the hair in this horseshoe shaped area on the back and the sides is the one that remains the longest. So I believe this is a relatively permanent area. And this roughly measures about 25% of all your hair population on the scalp.
Okay.
So only 25% is deemed permanent. If you were to lose hair, initially you come to me with only some problem in the frontal area, I put in hair, that area gets covered. But a hair loss can proceed further as per your genes.
Right.
You will need more than one transplant in your lifetime. It may also be a situation where you may not have adequate donor material to fulfill the requirements. So the demand-supply ratio is always skewed unfavorably in most patients. And that is why you need to have a combination approach where you use medications to stabilize the hair loss and use the transplant to fill up the areas where medicines may not be that much beneficial.
Right.
So it is when I counsel patients, I tell them that hair transplant is permanent, but it is relatively permanent. There is going to be a change in the transplanted hair over 5-10 years.
Right.
But it is still going to be better than what it would be if I had not done anything.
Right. So how is the procedure done? Like, when the patient comes to you, what is the counseling? What is the checkups?
We need to assess the patient.
Right.
So a global assessment is done. The next thing is using a trichoscopy. It's a device which is a USB based microscope, which we can look at the scalp and look at the variation in the hair follicle, hair shaft diameters, and look at the scalp condition, look at the areas which are involved, areas which are not involved. So get a complete picture of what prognostically is possible, means going forward. And then understand what the patient wants, what are his concerns or her concerns, what they are expecting from us. Many a times patients, because of their information they glean from the social media and the internet, they come with unrealistic expectations which cannot be fulfilled in every patient, because they expect that what they see on the social media or on the internet is something that can be fulfilled by a hair transplant.
Right.
So counseling them and setting their expectations right is the first step that I feel
very important.
The most important. And just because that person has hair loss, that may not be his problem. He may come to me with frank hair loss, but may have a scalp issue which is bothering him. He's got flaking, he's got itchy scalp. So understand what has he come to you for. Just because he has baldness doesn't mean you treat the baldness.
Right.
You treat what he is concerned with.
Right.
And counsel them as to what is the fact and what are myths with regards to what can be achieved. And if they are comfortable, then we go to the next step of looking at hair transplant as an option. Now, the most satisfying situation for the patient and the surgeon is to restore a hairline that has been lost.
Right.
Frontal baldness, which makes the patient look age inappropriate.
Right.
Much older than his chronological age.
Right.
So, creating that frame for the face and giving him a hairline and the building up hair population behind it is extremely satisfying, because it changes the patient's persona completely.
Not only physically but also a lot emotionally and psychologically, right? Builds up their confidence, their esteem.
Now, everybody may not have adequate hair to completely cover the bald areas.
Okay.
So that has to be addressed clinically. Sometimes in some patients, we can borrow hair from non-scalp areas, like the undersurface of the beard or the torso. These are not very similar to the scalp hair, but they can pass off by giving some kind of a filler density, give you some coverage.
Right.
So that requires multiple sessions. So patient needs to be counseled about these, how these hair are different from his scalp hair, how they will look cosmetically. All this needs to be explained before we go ahead with the transplant.
But just because today I have done the transplant, I am not going to see the results tomorrow, right? How long does it take to see the results?
If I do the transplant today, the transplanted hair usually are shed in the first 2 to 6 weeks.
Okay.
And then,
so first they are shed and then they again grow. Oh.
Then the follicle will start producing new hair. Sometimes some hair do not shed, they continue to grow. And you see a reasonable result, a change in the coverage by about 8 to 9 months.
Okay.
And the full result 12 to 18 months.
So that is what you also counsel before
Yes,
you do the
yes.
hair, because it's not
we
like
had a patient who came to me saying that 2 months later is getting married.
right.
He's not going to have that benefit
Absolutely
in 2 months.
right.
But someone who's planning his marriage
Right.
and getting the transplant done, if he's doing it a year later,
Right.
he'll have an optimal effect or benefit from the transplant.
So Sandeep, you have been doing this hair transplant for like how many? 20 plus
25
years.
years.
Yeah. So, I'm sure you must have seen the technology change over the years.
Yeah.
How has it improved and the patient outcomes?
See, hair restoration, the Japanese had done it in the 1930s. And the thing is that information was not, the world did not receive it because of the language issue and because of the wars that were going on at that time. But traditionally, after that, as plastic surgeons, more than moving hair follicle, they were moving the entire scalp. Either to remove the bald area and move the scalp or using flaps of skin to cover the bald areas. These were significantly morbid surgeries and they did not give an aesthetically correct look. In the 1960s, sponge grafting became popular where plugs of hair were removed from the back and transplanted. So they would give coverage, but they gave a very unnatural appearance where it looked like a doll's hair. If you see how doll's hair comes out. Right. So that was the issue. Then somewhere in the 80s, follicular unit was defined. Then follicular unit micrografting became a very popular technique, which was very natural looking, where you would harvest a strip from the back of the hair, suture up the donor area, and the strip was dissected under magnification into follicular units, and these were then implanted. So gradually people felt that, having that scar, linear scar at the back of the head was not something they wanted because then they could not sport short hairstyles. So then we began extracting one follicular unit at a time. And that has evolved to what we are doing today with a definite refinement of instrumentation. Instruments have become better.
So your job has become more easier.
I wouldn't say easier, it has become more precise. So I would say that is a better term.
So better outcomes you're giving the patients.
Our understanding also. See, there is, whenever new technology comes, there is first that initial popularity. Then you start seeing the adverse or the negative problems with that, and then you modify it.
Right.
That is when it gets refined.
Right.
So we are in the process of that refinement. So the refinement technically is not only from the surgical point, but it is also about patient selection and patient counseling. Because this surgery is done to make the patient feel good. If the patient is not happy at the end of surgery, in spite of having all the grafts growing, then it is not a successful surgery.
Absolutely. So finally set up patient expectations first.
Yes.
So, you're talking to so many patients every day. What are the actual myths related to hair?
So the common things that people feel is that massaging oil on the scalp is very good and with that the hair will grow.
Okay.
Because they feel it increases blood supply. Blood supply has never been the cause for your hair loss. Because when we do transplant...
But it does feel nice, when somebody massages.
See, the point is we have muscle only in the frontal region, the temporal and in the occipital. There is no muscle here. So massaging that area is not really going to help.
Right.
But a more detrimental thing is that if you are massaging it under unhygienic conditions, if you have not cleaned your scalp, so there is an entire microbiome on your scalp, plus the entire microbes that come from your hand and the oil, you rub it in. So there are pores which will be there and you push these things into that, you develop folliculitis and which can cause problems.
Doesn't sound too good now.
So I generally believe that if a feel-good effect is there, just massaging these muscular parts will help you.
Okay.
And using oil as a pre-wash conditioner is good because it softens your hair.
Okay.
Other than that, I don't think any role is there.
Okay.
The other thing people say is that if you shave your head once, you'll come back better.
That's what for small kids people do, right?
The point is that when you shave the head, you're just cutting off the shaft at one level, that is at the skin surface.
Right.
The follicle is the same as it is. So normally when the hair grows, it has a tapered end. So it appears softer. When you cut it at at the shaft level, it grows up as a blunt tip.
Right.
So it appears thicker.
Right.
It is a visual thing. It is not that the hair has become thick. It is just that the cut end is there, so people feel that it is becoming thicker, but it is not. So shaving will not improve the hair quality, and people think that shampooing their scalp every day is detrimental. So they don't want to put chemicals to their
many times you should not wash every day.
Just pour
it
water.
breaks the hair.
No, it doesn't cause anything of that sort, provided you choose a shampoo that has a pH which is similar to that of the scalp. Shampoo which is alkaline in nature will again raise up your cuticle scales, cause a little bit of frizz. Shampoos which contain a lot of parabens, obviously, they can be detrimental. There's a popular belief that people believe sulfates are bad.
Okay.
There is no proof that sulfates are bad. They are stronger surfactants. If you want to clean the scalp, sulfates are the best.
Okay.
But today we are looking at a scenario where people want surfactants which are milder.
Right.
And they don't want the sulfates. So you have shampoos that are having a pH of 5.5 is what they popularly look at. Then paraben free, sulfate free. But the idea is that you generally have a 2-in-1 shampoo which has a mixture of surfactant and a little bit of conditioner, so the hair doesn't feel dry. So shampooing your hair every day using a mild shampoo is not bad at all. Because if you look at a simple thing, for you also, you wash your face twice a day with a soap.
Absolutely.
Or face wash.
Yeah.
Have your eyebrows gone away?
No.
The bearded person will be washing, mustached person will be washing, nothing happens. So the point is that when it comes to the scalp, people are very touchy about these things.
Yes.
So as long as you choose a shampoo that is mild in nature, there is no problem.
So just wanted to ask you, any funny or unique patient stories you want to share? Like, I'm sure you must be having many.
Well, they're not funny, but it was
something which has stayed with you.
Almost a decade ago, there was this patient who had come from a different country where they have, apart from the passport, they have an ID, an ID card. So when he had come the first time, he was totally bald, and his ID had that photo, and we did his transplant, and he went back, and then he was coming back for his second session about a year later.
Okay.
Where his face had changed.
Obviously.
So they actually held him at the whatever that the passport
immigration, right?
And they didn't allow him till he proved that he had undergone a procedure. This was done. He wrote this entire thing to me in an email. That is how I know about it.
Right.
So it was his.
Hair does change, like, your looks, your personality, everything. So that's, this story does say that.
Yes.
Right, Sandeep. All this time we have been talking to you as Dr. Sandeep Sattur. But now we would like to know Sandeep, the human being and the person behind the doctor. Okay. So I'm going to ask you some questions, not medical. Let's see what you have to answer. So, do you have some memory of a med school teacher who has influenced you in some way?
I think at every step of medical education, you meet somebody who kind of knowingly or unknowingly guides you to doing things. Our first anatomy teacher, I think, was a very different kind of person, but he did influence me the way I approached the subject. Then when we were doing general surgery, we had a registrar who influenced us by his personality.
Yes. And that is the reason you took surgery?
No, surgery I wanted to take even otherwise.
Okay, fine.
Then in plastic surgery, there were one unit head and his associate who were actually key in me continuing with plastic surgery, because it was not my first liking or choice.
Okay.
And finally, the head of the department of plastic surgery, he was very fond of me and wanted to. So these people kind of, in their own way, gave you facets of their personality which you try and tend to emulate and follow.
Nice to hear that. Any undoctor-like hobby you have? Otherwise, doctors are so focused in their job, like whole day they are busy with it.
I love listening to songs.
What kind of songs?
Everything. Every genre is, I listen to them, but I love the typical old Hindi
Bollywood music
songs. And
who's your favorite singer?
I like Mohammad Rafi the most, and I love cinema. I keep watching these offbeat movies also. Then I do like to dabble in some painting. I used to do it regularly in my undergraduate days. There's a big break, and I have just restarted exploring media like the acrylics. I've never worked with them, so I'm just learning the basics.
Great. Okay. Suppose if you could exchange your life with somebody else, would you want to do it? And if yes, with whom?
I don't want to change anything.
Perfect.
I'm quite content with what I wear.
That's a great answer. Okay, what is the favorite type of vacation? I mean, do you like beaches? Do you like mountains? Or any particular type of place?
I love road trips, wherever they may be. I love road trips. If it's possible, I would.
So you love to drive?
I love to drive. I love to be driven. The next best is a train journey. I love train journeys also.
When was the last time you have had a train journey?
Quite some time back.
Okay, tell me, this career, like medical career or your plastic surgery career, whatever, has it changed you as a person?
Yes.
In what way?
I have always felt that when we were learning medicine, the key lacking in our training all through was empathy. We were never taught empathy at all.
How true? Seriously.
So I have always felt, and that is now when I'm dealing with, when patients speak to you and they are emotionally very labile.
Absolutely.
That is when you realize that what they want is not some fancy treatment, but understanding their problem. And if we counsel them properly, they are quite happy. Even if you don't go ahead and do the surgery for them, they are quite happy that you have understood their problem and counseled them appropriately.
Right. You could make them feel better about themselves.
Yes.
That is so very true. We really didn't have that kind of learning. Okay. So this is the last one. Do you have any particular object? It's a very meaningful object in your clinic. Something which holds a memory. Or something. You want to keep it in your clinic.
Yes. There is a bell. A tapping bell that used to have. It used to be a bell which my dad had in his clinic.
Wow.
So it is a bell that I still use.
That's a very strong emotional bond if you have it.
I still wear his watch.
Oh, wow. So sweet. So Sandeep, this conversation has been truly eye-opening, and I'm sure this will help a lot of our viewers, have that self-belief in themselves. So thank you so much for joining us today.
My pleasure.
I'm really happy to have you at the head.
My pleasure.
Thank you for tuning into today's episode. If you enjoyed the conversation and found it helpful, be sure to subscribe to The Health Talk with Dr. Sagorika Mullick for more such insightful discussions. You can follow us on Instagram, and remember, you can also catch this episode and more on Spotify or your favorite podcast app. The links are provided in the description. We would love to hear from you, as your feedback will help us to bring you the topics that matter most to you and your family. So until next time, stay informed and stay healthy, one episode at a time. And don't forget to like, subscribe and share this episode. Your health journey starts here.